All right. Hi, everyone. My name is Lance. I am the founder of HealthySimulation.com. So excited to have with us here the team from ReelDx, including Ryan, Bill, and Marie. They have been working with me and HealthySimulation.com to start to promote their company and their work, which I think is really unique to the space of clinical simulation, providing for real patient intake videos and real patient recorded sessions from actual patients during their clinical engagement, and then allowing us as clinical educators to utilize that in our simulation experiences or just in our clinical educational programs, right? So something that I have not seen anywhere else before. I was so blown away that they were able to do this. Like, how did they get past HIPAA? How did they able to get permission from some of these patients to do this, right? Because obviously cameras in the space during that chaotic time seems tricky to do. So here they are with that in terms of successfully accomplished. And so excited to learn more about their product and their service and how it can help us here with our program. So before I turn it over to the team, I just want to remind everyone that I will be following along with the chat room here. If you have any questions during the presentation, please feel free to enter those into the chat room and I will relay them to them during their presentation. So with that, I'm going to turn it over. So excited to learn more.
Well, thanks a lot, Lance. My name is Bill Kelly. I am the co-founder and CEO of ReelDx. Thank you all very much for spending some time with us today. We're excited to show you what we have and to help explain why we think this is relevant and valuable in the context of healthcare simulations for education. I'm going to share a screen here. Let me get there real quick. With just a couple of slides to help frame up the context of what we're talking about. First of all, let me also introduce my colleagues from ReelDx. We have Ryan McCoy, who's our sales director. Ryan will be giving a full demo of our product and some of the content that we have on the platform when I'm done with what I'm doing. And then Marie Gonzalez recently joined ReelDx as the newest member of our sales team. Marie is very experienced in healthcare simulation as well. So she's a great resource for all of you. And I invite any of you to contact us directly if you have questions or would like to follow up on anything. So let me reiterate what Lance said at the top and then give you a couple of things to think about as we get into the demo here. What we're going to be showing you is a little different than what you may expect to see on HealthySim as a topic, because we're not a simulation program. As Lance described, we are a library of real patient experience captured on video and produced into presentable cases that can be incorporated anywhere in healthcare education. We have programs that use us with their students in didactic instruction, in clinical instruction, and in simulation experiences as well. And we serve clients that are higher ed, preparing the next generation of healthcare worker. We've got partnerships in pre-med, so undergraduate students that are preparing to apply for healthcare programs. We have partnerships in to help clinicians in practice with continuing education and with information that helps them in their practice. So really in the full life cycle of pre-med all the way through to practice, the content that we've developed and present is highly relevant. So let me get into this a little bit. So apologies if this is a little pedantic, but I think it's useful to start with a little bit of educational theory. And I'm starting with Bloom's taxonomy here, which if you're familiar with it, you'll understand what I'm saying. Let me just give a broad brushstrokes description here. Bloom's is a way to conceptualize and talk about and even visualize the student journey from introduction to a subject to mastery of a subject. Bloom's gets organized into three different domains: the cognitive domain, which is knowledge and inferences based on your awareness and fluency with the concepts. It's the psychomotor domain, where you're applying knowledge into physical activities that are required in a learning domain. And the third is the affective domain, which really has to do with the self-awareness, confidence level, and level of empowerment of the individual to perform their tasks. I think each of these domains is highly relevant to what we're talking about today. We know from the literature that, that simulations are excellent at moving students up the psychomotor domain. Their physical engagements with the material in repeated practice. They also help with the cognitive domain. So they help students reinforce and improve their ability to apply the knowledge that they're gaining. We also know from the literature that case-based or problem-based learning is excellent at helping students advance in their affective domain, their ability to confidently approach new problems and the empowerment to engage with those problems. So what we're proposing here is that by combining the very efficient case-based learning approach that a program like ReelDx can offer with your simulation activities, you actually enhance the cognitive reinforcement of those sims, and you're bringing in the affective domain into that simulation exercise. So you're really addressing the student's full learning needs through that simulation activity. So hopefully that will help you frame up like what you're about ready to see in the demo. My last slide here is some suggested applications, some specific ways that ReelDx cases can be utilized in conjunction with simulation activities to achieve that full spectrum learning success. So the first one is take one of the ReelDx cases and use the details of that case to set up your sim. So students are walking in, engaging with a simulation that matches what they've seen in video in one of our cases. The benefit of that is that you can help students suspend their disbelief, more fully engage with the simulation exercise itself, because they have in mind the sights and sounds of that actual case as it actually occurred. A second idea, assign a set of related ReelDx cases in advance of a simulation exercise to get students in the mindset of understanding case evaluation and thinking through the issues that are going to be their challenge during that simulation activity. For example, you could pick 5 pediatric respiratory cases out of our library, assign them to students in advance of the simulation activity, and then they come into the sim already kind of predisposed to be thinking in the direction you need them to think. And then you can hit them with the physical exercise of the simulation and start to really maximize their learning across the board. A third idea, assign some cases after the fact, after you've done your simulation, that are relevant to the simulation that you offered. And do it in a way to do compare contrast exercises or to challenge them to do case evaluation and case planning based on their recent physical experience with the sim, the cognitive advances that they've made recently on the content, and then using those additional cases that they get assigned, it reinforces the cognitive and advances the affective learning as I described before. So those are just a few examples. There are probably other examples of learning strategies that you can deploy when you're bringing in the ReelDx real patient case experience into your simulation environments. So with that, Lance, do you have anything you want to interject at this point, or should I turn it over to Ryan for the demo?
I just I think to support that this is complementary, right? In that it augments the work that we're already doing in clinical simulation to provide for a way to make these cases more realistic. And because you can't get more real than real, right? So here's a way to kind of help bridge that gap between simulation world and real world. And, having gone through EMT school and fire academy to the simulations that we were able to accomplish at that level, this was 10 12 years ago now, so there's obviously been a lot of advances, but it was limited in that I just felt always like it was make-believe only, right? And so we had my one 12-hour stint in the emergency department and my one 12-hour stint on an ambulance, which was fantastic. And, we could do more of those types of volunteer opportunities, but how many patients can you see in a 12-hour stint? Well, in an ambulance, you might only get 3 calls because then you got to go clean up, the ambulance after a patient is in there. So you're only going to get 2 or 3. What a cool way to augment that with even more real cases. So really excited to check out the platform.
Yeah, great. Thanks. Well, at this point then, I'm going to turn it over to Ryan, who will run us through a demo of the product. And we look forward to conversation with you and to answer any questions that you have. So take it away, Ryan.
Okay, Bill, let me show. Okay, good. Hello, everybody. I'm Ryan D. McCoy with ReelDx. I just want to make sure you can see my screen, or you can see it. Good, thanks. So I'm just going to kind of back up to what Bill said. So primarily, ReelDx sees a lot of EMS customers, PA customers, and NP programs that utilize ReelDx. We have undergraduate programs and other programs that utilize it as well. So we have close to 700 cases, and we call this a resource library that can be deployed in a wide variety of ways. But a lot of institutions use it for their didactic, simulation, and clinical rotations, and it helps standardize those pieces. So the platform itself is very easy to use. Right here, we have a search box. You can type in a symptomatic presentation of some type. You type in fever. It will pull up all the cases related to fever. And we also have ways to filter out specific cases as well. So cases with other media, so we might have x-ray, CT scans, or additional video. You can start out that way. Cases with a basic physical exam, or cases with filters. I know we do demographics as well. So gender, race, age category. So programs that need to focus on pediatrics, you can click through here and pull up all the pediatric cases to view as well. Organ system, clinical location. Again, we're just talking about EMS programs that utilize it. So the preclinical cases where a paramedic will have a GoPro on their chest. They'll come to an accident scene right away. They're the first responders. So we have a wide variety of cases of those, probably close to 100 cases out of the 700 are those preclinical cases. And we also organize down by curriculum, by different, so advanced practice, APN curriculum, COAM curriculum, and PANTS blueprint. So we try to align our cases with those. And we also have medical specialty libraries as well. You can filter out, and you can filter out by developing our ReelDx libraries that we developed ourselves. So if you're looking for developing world medicine, emergency bedside, ultrasound, you can filter out this way. So what I want to do is jump into anatomy of a case right now. And this one right here is a popular case. So each case, we have a chief complaint. It's titled with the chief complaint, and we have a case number associated with it. We try not to reveal the diagnosis during this case vignette, but with these being real cases, in the healthcare providing asking questions, it does sometimes lead to a diagnosis. I do want to make you aware of that because these are real cases. So I want to play this and let me know if you can't hear it.
Good afternoon, I'm Dr. Moore. How are you doing?
Well, I could be doing better.
I'm sorry you're here today. Thanks for being willing to do this video with us. Can you tell me what happened, what brought you in here today?
My hip dislocated.
Okay. You've had this problem before?
Yes, I've kind of lost count. It's the 4th or 5th time it's happened.
How did you do it this time?
I was just getting out of bed the normal way that I do, because I have been ambulatory with a walker.
Okay.
And I went to get out of bed, and I had this excruciating pain. And having experienced this before, I was pretty sure what happened.
Yeah.
And when my daughter, tried to help me get up, I couldn't bear weight on it.
Yeah. Okay. Now you've had problems with this hip. You had an operation on it, is that right?
Yes, at the beginning of March, they did some kind of a revision or arthroplasty.
Arthroplasty?
Yeah.
Yeah. Okay. And it's May now, so that was 2 months ago?
That was, yeah, the beginning of March.
Yeah, but it keeps coming out, huh?
Yes.
Okay. And we'll just take a look at this leg real quick. So it's the left one that's bothering you, right?
It's the left one.
You're able to move it and feel it, but does it hurt to try to lift it up?
I can't.
Can't do that.
I mean, I could, but it will kill me.
I understand. Okay, so we talked about doing this procedure. We're gonna give you some medicine to make you sleep.
So I'll go ahead and pause that. I presented this case this morning in a demo, and it was great seeing the educator just point out things I didn't realize at first. It was like, obviously, this patient has healthcare background knowledge because I can just tell by how articulate she was. It really picked up on a lot of things that could be used in a didactic program. So most of these case vignettes are between minute to 3 minutes long. We do have some that are 12 minutes long. I know we have a case where there's a paramedic comes up to a heroin overdose. And so they go through the whole process where they administer Narcan. So that was more of our longer videos. But most of them are a minute to 3 minutes long. We provide closed caption for 508 compliance. And these are great for didactic setting in a Zoom setting like this. So you can pick up a case on the fly, break it, have the students go into breakout sessions. They can come up with a diagnosis, group discussion. So, and these are so short that you can keep keying these up on the fly during the classroom setting. What we also provide is content or the cases organized in these drawers. So we'll provide vitals and demographics. We'll provide a differential diagnosis workup, the actual diagnosis. Then we'll provide actual outcomes. And this one will provide treatment disposition, but we're going to provide additional information as well. We kind of consider this a bucket that captures all this other information from x-rays, CT scans, additional case video. So in this one, for example, you can definitely see how the hip's out of socket there. And we provide a case video of preparing the sedation. And we have the initial sedation attempt right here, the first reduction attempt. And I'm just going to play a little bit of this just to kind of show how this stands out a little bit differently than a virtual reality scenarios, because you can definitely see the pain, the challenges that happen.
I know, okay.
We gave her 12 and a half more of propofol and 25 more of fentanyl. We give it maybe a minute to sink in.
Just relaxing.
How you doing, Miss Wainwright?
Oh,
It's like when don't touch it. Because if you hit the stuff thing, it will turn it on.
Still pretty painful.
It's trickling a little. I'm just pulling flexion right now. She's still resisting me a pretty good amount.
oh.
So,
150, 189, Kim.
give her a couple more seconds. See if it sinks in a little more.
She's still feeling that sound. You want to try a little more?
Yeah.
So just again, just to kind of show you what's, the difference between virtual reality and reality. It makes a difference when you're, teaching this with your students. We have the reduction attempts. We have a re-examination, post-reduction case video. Then actually now you can see it definitely has back in place. We offer third-party standards reference of care for you to refer to. Most of these are free subscriptions, but we have been getting more requests for other subscriptions to be attached to these cases. Then right here is the key points and editorial. This is a write-up from our medical board. This is geared primarily for faculty to utilize. And these cases are always being updated within an 18-month time frame, if not sooner. So this is the authors of the case and when it's last updated. And this is a new feature that we just added. It's a faculty form. So students don't have access to this, just only faculty. And one of the reasons we brought this on, as the world of COVID has come and it's made a lot of programs shift to online curriculum, there was a request for needing help of best practices, how to utilize cases, question about cases. So we created this form for a way to educators to connect with your peers from not only at their university, but other programs as well. So if there's questions about cases, we have this new functionality that's now available. So from a high level, this is what a case looks like. And before I continue, I was going to see if anybody had any questions, Lance, or if there's any questions in the chat room, please let me know.
Yeah, folks, feel free to enter into the chat room any of the questions that you might have. I have a question with regards to, for example, the diagnosis. Is it possible to deactivate that learner so that they can see the case, but then they have to make a determination themselves? And so we can use some other kind of learning management system or process for recording their answers and then making sure that it lines up?
Absolutely. I want to show you a little bit of that here in a little bit. I just wanted to see if there were any questions before that.
From Dr. Scott Crawford, he asks, are you open to new submissions? So I definitely think Scott would be an excellent candidate to be a physician in your pool. So yeah, is that something that you are looking for additional healthcare providers to be members of the team for gathering these cases?
Yes, thank you for asking. We're very interested in having the conversation about becoming case contributors. So yes, I'll put my email address in the chat, and please feel free to use that to contact me if you're interested in contributing cases.
And Deb asks, how do we get around the confidentiality?
Yeah, let me answer that. We consent every patient that appears in this environment. In fact, we won't upload any of these cases if we don't have full patient consent. Patients consent for use of all the case data that's relevant to the case, anything that comes out of the EHR, anything that's said verbally or described by the doctor. The patient also consents for use of their video image in any form. So we have fully consented the patient to participate. We also give patients the ability to rescind their consent at any time. If they have second thoughts about it, they can contact us and ask for that case to be removed. It's never happened, not once in the years that we've done this. And you know, I'm happy to report that we get in excess of 90% patient participation in this. Sorry, I got distracted by something. But the patients, when they hear what we are doing, they're happy to participate. If you run that video that Ryan was showing to the end of that first sort of intake video, at the end, the doctor says, "Thank you for letting us video you," and she says, "You know, you're welcome." Some patients say, "Thank you for letting me tell my story." You know, wow. So we don't have a problem with patient consent.
That's awesome. You know, just a quick aside there. One of the responses I had to one of my presentations about the use of video technology in the healthcare space. And I was arguing that basically, like the aviation industry, we need more of a black box like technology in healthcare to record what happens in these spaces so that we have a very authentic record of the situation for purposes of learning, right? So if there's an event, we can go back and have more authentic perspective about what took place in the space, like a black box does in the event of an accident in aviation. And one of the CEOs of a major medical simulation vendor, global vendor, said, "Well, how do you get around, you know, patients and HIPAA and wanting to be videotaped? Some of these procedures are very, you know, personal, and you know, private." And I had to think about that one for a moment. It's like, yeah, how do you get around that? Well, I did some thinking on it, and I thought, well, what if you were to slide a piece of paper across the desk of the patient, you know, obviously in a non-emergency situation, or if they were capable in a moment, say, we'd like to record this engagement, patient engagement, for the purposes of learning, education, and training. And oh, by the way, if we do, studies have shown that there's actually an 80% increase in performance from our caretakers for your care because of the Hawthorne effect, which is when cameras are in a room, people do better at their work. And I bet you that most people would sign up for it. So I am so thrilled to hear this confirmation on my theory that actually, yeah, people are more than happy to engage with something that is extremely private for this person with regards to their healthcare situation, because they know it's going to improve the process and also make them a part of the engagement in a more ongoing capacity. So I'm thrilled to hear that. And I think that that is amazing, and, you know, demonstrates to me the reality is that people are less concerned about how they look and more concerned about their care, right? And this, I think, furthers that cause. One other question that came up here from Catherine, which I think is a little bit about the opportunity to experience these cases or demonstrate the service to their faculty and other members of their team. Do you have any kind of trial opportunity or way to showcase to some of these patient cases so that they can demonstrate what they're seeing here in this webinar, which, by the way, is being recorded and will be available at no cost to anyone. So, you know, we can replay this presentation for sure, but, you know, going beyond what we can see here and just kind of demonstrating the platform, is there any availability of that?
Absolutely. So I just put a link into the chat to public.realdx.com. We have a handful of cases that we've made publicly available, so you can experience those cases, you know, without any further friction. But on top of that, we would love to schedule a direct demo for you and any of your colleagues. Ryan and Marie are the ones to work with you on that as well.
Yeah, so we can coordinate that, and we totally encourage it. We offer extended, you know, a month-long trial period, so you can actually utilize with your students, because once you do that, you will see a tangible asset right away. You'll see the engagement with the students. You hear it. I've seen it where, you know, the students like this, and when this vignette pops up, they're like, wow, this is what I'm going to run into when I actually become a you know, EMT or a paramedic. I mean, so it really drives home all the senses. But absolutely, we can set up a demo period.
Awesome. And Dr. Crawford asks, he suggests it's very powerful educators. He's done this on a small scale for his residents and local use, but are there cases that are perhaps, you know, the most private, OB-GYN, cervical exams, you know, rectal? I mean, are there cases where we get to that level of procedure?
There are a few cases in the library right now that you would consider, you know, that highly personal, highly intimate kind of thing. We are lacking, frankly, in mental health and OB-GYN cases right now. So anybody who would like to work with us to collect those cases, both of those topics need, you know, an extra layer of ethical consideration with the OB-GYN cases. If we want childbirth cases in our library, we're going to have to work with those families prior to the event.
Sure.
I don't think throwing a video camera in a birthing room at the last minute is going to go.
Hey, how about this thing? Yeah, yeah.
So, but you know, we have a ton of preclinical with a wide range of patient types and symptomatic presentation. We have a ton of emergency room, a ton of peds, lots of community health, a lot of really interesting subtopics like eating disorders and world medicine, developing world medicine. So, you know, there's a lot in there. We're over 700 cases now, and we're adding new cases at about 2 or 3 per week right now. So, you know, there's a lot there. There are definitely areas where we're particularly strong and areas that we're working on adding more. And unfortunately, GYN.
Sure. But I mean, now this company is new. It's not like it's been around for 10 years. How old is the company so far in terms of active process and this, you know, to the point where?
About 5 years old. So we've been at this for a little over 5 years. Yeah, and so we're still learning. We're still growing.
Right. Lots of opportunity for growth here. And that leads into another question that I have. You know, approximately how many new videos are being added, say, monthly to the system? Right
now, we're doing about 8 to 10 per month. We'd like to get that up to about 20 per month. And then I noticed a question from Deb Tauber about mental health. Yes, we are actually very interested in getting mental health cases in. We can do those through telehealth or any other method. It requires one extra step of consent to make sure that we're on good ethical footing. And we've done a little bit towards that end, but we'd be very interested in having more people work with us on the mental health side. It's a very important aspect of what we do, and we get asked for it a lot. So.
Great. Just to button up that last one, Dr. Crawford asked, can you do mental health acceptability for consent?
Yeah, so like I said, there's an extra ethical issue. We can't really recruit mental health patients directly through their providers because it creates a little bit of an ethical consideration for the patient-provider relationship. So we're working on ways to recruit those patients not through their providers directly, but then work with their provider to get their history and clinical records so we can build a full case out of it. It's just an extra couple of steps to get there. And the first ones that we're working on are definitely going to be captured in more of a telehealth setting. So through a Zoom engagement rather than an in-person engagement.
Great.
Okay.
I just wanted to share, if it's possible, just two brief vignettes, just to kind of give you an idea of the spectrum. So we talked about ER and altered mental status, and so I just want to kind of give you an idea.
So what brings you in here today?
I ran out of my anxiety medication like a week ago, and I'm an alcoholic.
You're an alcoholic, and
so
when was your last drink?
About an hour ago, but I threw it all up, but there was blood in it.
What were you drinking?
It's like.
So I'm going to just go ahead and pause. I don't want to, but I just want to, point out, I just shared this the other day, and I again learned something new. Someone said, hey, you know what? She looks like she's a healthcare provider. She looks like she could be a paramedic. This is where I would start questioning my students of, do we trust everything they say? What's going on? They really, so, I mean, during that short little brief, what I shared, they're like, oh, this is great. Because this is something that, again, you would see, this weekend, probably working in the ER or coming up to a patient that way. So, and then I just wanted to show a quick pediatric case as well that's popular to use. And I'm just going to skip it. This one has a little bit of long intro, but this is a situation where a child is having a seizure, paramedics come up, the distraught mother, you're just in this whole different scenario.
I will point out that the long lead-in is really important for EMS training, because scene awareness and evaluating what you're dealing with is so important in that EMS training. That's why we left that long lead-in in the video. So anyway.
Yes, good day. Guys. My name's Elliot.
I have his procedure too. Thank you.
Okay. What's going on? Is he still seizing?
I think he's chilling now. I think it's what he's doing, but I think he's
okay, what time did this start?
I don't know. It happened like what time is it now? I don't know. I noticed it and I don't know how long it was going on. I don't know how
25 after. 14:25.
So I think it was probably 2:15. 10.
So again, I won't share the whole case video, but it just gives you an idea. You see the distraught mom, you got a child. I have girls that are this age, and it emotionally starts charging you when you watch this case video, and you're just like, okay, now give us a diagnosis. What's your care plan? I mean, so for education purposes, this is another example why ReelDx is also to use.
Right.
So,
yeah. And some of the things that they would do at Fire Academy is they would show us some of the videos that they had taped of specific fire situations. And it really brought things a lot more home for us in terms of some of the engagements. And so, I mean, let's be honest, some of the limitations that we have with high fidelity mannequin technology is we have a patient that's talking at you like this with their mouth open and they're not responding. They have no emotional interaction, right? And as much as we would like to have our standardized patients or our other Confederate learners be a part of presenting, mom in a case scenario where they're upset, or dad, there's something that you're never going to get to a level of authentic realism as you are in a real patient or emergency situation. And so I think this kind of level of realism is just something that we can't find elsewhere in terms of it's real. So, this just in terms of my own EMT and firefighting, it's like these types of tools are extremely helpful for, witnessing these things. And, yes, you can get some of this by YouTube, but to me, it's just like, you're not going to get any of the documentation or authenticity or the standardization that would be required to understand really what's happening from start to finish. And so that's really crucial. We don't want to have any of these kind of just like by the seat of our pants engagements and teaching opportunities. I mean, some recorded videos, we can learn from, but in a way of getting systematic with their education and learning, I think this is really important to think about from a structured perspective.
Absolutely. And so, Lance, I'm going to jump to that question you asked about controlling the content. So with ReelDx, you can control the content of what the student can see and when they can see it. So right here, I created Ryan's Demo Course 101, and I assigned all these cases either to my class or to a particular student, and I'm going to control the content. So you can click on Schedule here. Green shows what the student can see. Gray is it's hidden from the student. Yellow shows when the student's going to be able to see the drawer of the case. So, for example, I'm going to select these 3 cases, and I'm going to say, you know what, class is going to start on the 12th, and it's going to go through the end of the month. And I'm going to hide the vitals. I'm going to hide the differential diagnosis and the diagnosis. I'm just only going to present the vitals and demographics because I want to have the students write up a differential diagnosis, or I want to have them get prepared for the simulation that's coming up next week. And so, you'll share this information, and we're going to do a class discussion on the 16th, and that's when I'm going to reveal the diagnosis at 2 a.m. in the morning. Save it. So now you can control what the student's going to see in the classes. And we also have this dashboard feature, which a lot of programs utilize now, because you can see what the student's looking at, and either by case or by student. But programs are needing to, they're using some of these cases for virtual clinical hours or actual clinical hours. And this is a way to record to see, okay, the student watched the case video, they were able to click on it, they viewed it so many times. Now I want to export it in an Excel spreadsheet for a method of record. But now we're seeing more programs that are utilizing ReelDx as for clinical and virtual clinical hours. So this is one way of recording that.
Just to clarify here, is there a way to import or insert questions that you want to ask learners here or is that going to be done maybe in our own learning management systems?
Bill, do you want to speak to that?
Yeah, right now it would be done through your own LMS. We are working on some ways to add some assessment capabilities and some activities into the cases, like maybe having a structured SOAP note or other kinds of standardized formatting that students can respond to and submit. But right now, the way it stands, you need to assign any kind of assessment or activity in an LMS or in some other way.
Sure, and that can be as easy as just using Google Docs and Google Forms. I mean, literally, if we need to just do Q&A based off of this system, but I'm sure most of us have some type of learning management system that we can utilize here or other process that's easy to incorporate. However, it sounds like this might be part of where we're going with ReelDx in the future.
Yeah, definitely. Can I address a couple of questions that have come in through the chat?
Absolutely.
So one question that was asked is whether we have hospice cases. We might have, Ryan, do you happen to know if we have any hospice cases? I don't think we.
Let me look.
Look in the secondary locations and see if we have a hospice.
I thought I was looking at it at.
Down there, there's hospice right there at the bottom. See what comes up on that. We might have a couple of hospice cases, but if we do, no, we don't have any right now. We'd love to work with you to get hospice cases. And then there's a question about pricing. So the pricing, let me just go into that real quick, and then we can reiterate it if we need to at the end. We do structure pricing to be modular, so it can flex with the size of your organization. There's an institutional account that's required. That's $775 a year, and that's required for everyone. We have faculty accounts. That institutional account gives you one faculty account. If you need additional faculty accounts, it's $275 per year. And if you want to add student accounts, it's $69 per year. And we can arrange it so that your institution can pay for the students, or you can have the students pay for their own, like they would a textbook. And they can do that through a direct web interface, or we can engage, we can fulfill to the student through a bookstore setting. So there's some flexibility on the student side. But it is a modular pricing model. You only pay for, the accounts that you actually need, and we can flex and grow with you as your use grows.
And I was just going to share the screen real quickly, Bill, just kind of this, from a high level, what the pricing looks like and what we have.
Yep.
Great. That makes it really easy to understand. Okay. Well, I mean, if we have any other questions, please feel free to enter them in now. Anything else from the team that you'd like to share at this point?
From a high level, that's ReelDx. I mean, definitely COVID has shined a light on us, but it's every day. We're talking to everybody every day. There's been a lot more interest. We're seeing, I talked to a school last week. They were like, I can't believe I didn't answer your email sooner. I was taking clips from Night Watch to embed for training. And I've heard all kinds of wide variety stories of what they're doing to augment for real patient cases that, definitely there is a need for. And even prior to COVID, it's still ramping up. We're having customers just add on more student accounts. They're really looking, to really emphasize on how to utilize this. And it's really good. I've seen just so many good reactions so far.
How many institutions are utilizing the program right now?
About 125 institutions, and we're adding, I don't know, in January, we added about 10 new customers. We're adding
Awesome.
at a pretty rapid pace right now.
And then I just have a few more rapid fire questions. Are all the cases US based, and is there any plan for international?
Not all of the cases are US based. We do have some cases that were taken in European settings, in South American settings, in Caribbean settings, and in African settings. So, and we're interested in cases from other parts of the world, and interested in supporting educators all over the planet. So.
Great. And all the cases, the video cases are transcribed. I was noticing some transcription, so they're all transcribed.
We put every case through the creation of a closed caption loop into English. If we need to, we can pretty rapidly get those into any other language. The service that we use has a translation option. We just haven't done it into any other language.
Sure. Okay, great. Well, I don't know if it's abundantly clear from my face, but I think ReelDx is doing something really special and really unique in the world of healthcare education and training. And so I'm all for it. Like, I really do believe that this is something that is, just thinking back on my time in, going through EMS and Academy, I wish ReelDx, because it just so quickly can make it easy for me to go through and see these patient case scenarios that I might experience, before going and doing my clinical rotation, which was nerve-wracking. I had to make sure that I adhere to all the policies, do the skill sets properly. And so, learning cases, there wasn't any just sit back and watch what happens. I was expected to be a part, and taking the blood pressures and stuff. And obviously those are really relevant experiences and need to be focused on those opportunities. But to augment that with something that where, I could see more of these cases, to me, it's just a no-brainer. And I think that has a lot of opportunity for our world in healthcare simulation to really support and drive home these things. So Deb agrees, and I think some others have suggested as well. So with that, we have put the link in there if you want to learn more about ReelDx right there in the chat room. Please feel free to click. Obviously, reach out to the team. I know we've got those public videos to watch and display. Of course, you can email me at any time, Lance@HealthySimulation.com, if you need help getting connected to the team or anything else related to healthcare simulation, obviously. Again, HealthySimulation.com/webinars for all the latest in terms of the webinar content and expert advice and product demonstrations that we're doing here now. And so with that, I just want to thank the team and thank everyone here for participating. I'm really excited about this, and I can't wait to hear about your utilization of this of ReelDx. If anyone here starts to incorporate and utilize these, I would love to hear from you and love to hear your experiences, because I just can't wait to hear more about how this is going to be successful for groups. I'm really confident that it will be. So with that, thank you to the team.
Thank you.
Thanks, everyone. Really appreciate your time.
Thank you.
All right, cheers. And again, this will be available recording will be available in about half an hour. And I think the same link that we all use to register should be available there. So I don't think we'll have any issues there. If not, email me. All right. Thanks, everyone. Cheers.
Thanks, everyone.
Bye.
See ya.